start, it would be great to hear a bit about your background.
Sure. So I'm a radiologist. I do breast imaging, and I'm also have been very active in my career in organized radiology, very committed to diverse leadership in healthcare. And I've been happy to work with the team at Agamon. Was really initially attracted by the fact that you have a female founder, but also, I'm interested in solutions that are real world and make a difference and actually solve clinical problems that we have for the benefits of the patients we serve.
Great, thank you. We're happy to have you on board with us. So our focus today is about how radiology fits into the continuum of care. And I'd love to hear that actually from you. How do you think it fits into the continuum of care?
So I have often said, I probably am not original in saying it, that radiology sits at the interface of technology and humanity. So I think we are integral to patient care, even though a lot of the focus of our work is to do with technology and systems. And I think uniquely, we interface with pretty much every other specialty in the healthcare system. So I think often we can serve as aggregators of information and facilitators of care. I think we have opportunities to do more of that, but uniquely, we're the place where everyone goes for answers. It's why I chose radiology, because that was where we found out the answers to the patient's problems.
Absolutely. So, today when we look at radiologists in general, they usually create and send over the report to the referring physician, but they don't really have a way to see the progress of that patient. Do you think that's something that should change in any way?
Well, I'm a breast imager. So, for many years now, we have been tasked with not only doing that, sending a report to the doctor, but telling the patient about their what's going on and tracking that patient through to either a biopsy with a hopefully a benign or sometimes unfortunately a malignant result, and or getting the patient essentially to the next screening exam. So it's something that's integral to my practice as a breast imager. And I think that it can seem daunting to think that we would expand that kind of responsibility to other modalities in imaging, but that's where I think we need to leverage technology, because I do think we're uniquely placed to support the patient and their clinical team through that journey and make sure that everyone has the information they need to take whatever actions are necessary for the patient's care. So yes, I think as I say, I think it can seem daunting without the right support and technology, but it's certainly something where I see radiologists have an opportunity.
So that's a perfect lead to the next question, which is how do you think technology can help us to better position radiologists and deliver more patient-centered care?
Well, at a 20,000 feet level, I always feel as if technology should empower us to do what we do as physicians better. I think too often we are contorting ourselves to fit with the technology, and there's all sorts of reasons why that is. Big health systems, legacy systems, need for security. All that a lot better than I do. But it seems to me that the precious thing at the center of this is the patient and the patient's interface with the team that provides care. So to me, we need to design systems that support that. And, I think that there's ample opportunity to do that and to do it better than perhaps we've done in the past.
Agreed. So I think there are challenges really around implementing these new technologies. You mentioned some of them. Obviously, there's lack of time from the provider side. There's not enough understanding probably about the technology on the clinician side yet. And also on the vendor side, not enough understanding about the workflow. So how do you think we can collaborate better as technology companies and you as clinicians to add most value to patient care?
Well, conversations like this are a great start, aren't they? Really to understand what, again, if we're going to put that patient experience in the center, really to understand what makes that meaningful. I think to be really demanding and rigorous of ourselves, and at the same time flexible. So, we learned a lot of important lessons during the pandemic. But I'm thinking about my own health system experience. We really adapted on the fly around what platforms we were using for virtual visits, because we realized that one size didn't fit all. Some patients needed a phone call. Some patients, were fine with the platform we had embedded in our electronic health system, and some others were much more comfortable with the one that was freely available during the pandemic, from another site. So I think we focused on the patient. We knew we had to see these patients, and we just made the technology fit. And it's only by having conversations with each other, with our patients, really importantly, that we're going to find ourselves in the sweet spot, I think, as regards the right kind of adaptation and technology innovation.
Great. Thank you so much for your time today, Geraldine.
My pleasure.